A very good afternoon to everyone. We are live from Prime Health. My name is Fahad Shahid. A very important day today, World Kidney Day. That is a very, very important organ of the body that we really need to look into. And here we are with a very special session. I should say the big topic that everyone's ignoring, and of course, living well with kidney disease is really, really very important. I have a very special guest today here with me, Dr. Sandeep Varma, specialist, consultant nephrologist at Prime Hospital and Prime Medical Center. Dr. Sandeep Varma has an extensive experience of 14 years, out of which in UAE he has been practicing for the last 6 years. Expertise of Dr. Sandeep is chronic kidney disease management, critical care nephrology, and transplant nephrology. Doctor, thank you very much for joining us today. I welcome you in this webinar.
Good afternoon. Yeah.
Doctor, talking about a very special day today, World Kidney Day. You know, it's really important. We all know that kidney is a very, very vital organ in the body, and everyone needs to focus on the health of your kidney, of our kidney.
Yeah.
Doctor, just wanted to, understand the basic thing first. What is kidney disease? How you would say that? If you could just elaborate.
Okay. See, the term kidney disease, or what you call like chronic kidney disease, which is often called, or basically we can divide kidney disease into acute and chronic. Or acute is something which happens all of a sudden, like for example, if you had taken some painkillers, or if you had some infection, where the baseline kidney function was perfectly normal to begin with, and then suddenly you have a stress on the kidney, and then there is an acute worsening of kidney disease, kidney function, which usually resolves after a few weeks. So that is what we call as acute kidney injury. Then comes the major part, like what we call as chronic kidney disease, which is have a wide spectrum. That is any kidney disease which lasts for more than 3 months come under the definition of chronic kidney disease. But again, that is staged, stage 1 to stage 5. The stage 1 and stage 2, let's say it is, we have a normal kidney function by measurement, but there are other abnormalities associated with this, like there could be some protein leak in urine, or there could be some blood in urine, or there could be ultrasound wise or imaging wise, there could be some abnormality, or even by histology, by doing a biopsy or by doing a surgery, we could find some abnormality. So those category belong to stage 1 and stage 2, where essentially the kidney function, when we measure, it is normal, but we have associated issues like this. Now, anything less than 60 ml or 60%, let us say, of kidney functions falls below stage 3, 4, and 5. So now we all lose kidney function after say 20 years, or let's say even after 30 years, let's say 10% per 10 years. So now as the population is aging, we could have like 86-year-old, 90-year-old gentleman or lady having a mild kidney disease, physiological, let us say, even without a core kidney problem, having a low kidney function just as part of the aging. So that is why, though we say that chronic kidney stage 3 is less than 60, we give more importance to chronic kidney disease, the entity of chronic kidney disease, when it is really less than 45. That is, stage 3 is divided into 3A and 3B. So 3B less than 45 is, so any kidney function less than, especially less than 45%, is considered to be under the umbrella of chronic kidney disease. So that is essentially what we have: CKD, that is chronic kidney disease, and AKI, that is acute kidney injury, that is acute kidney disease. Yes.
Great, thank you. So two parts you've actually explained around kidney disease. That's really great, Doctor. Now we've spoken about the kidney disease. Talking about the prevention of kidney disease, what is the preventive intervention?
Yeah, true. See, if you look at the spectrum of kidney disease or the population of kidney disease patients, let's say 60% of all these patients have their kidney disease due to some lifestyle diseases. Let's say, like if you go by statistics, almost 45% of kidney disease, or especially the chronic kidney disease, is due to diabetes, almost 15 to 20% is due to hypertension. So that means that essentially, if we could manage our lifestyle diseases properly and keep it under control, basically a large chunk of kidney disease in our population could be prevented, like proper control of sugars, blood sugars, if you have, and especially have a early checkup or daily or yearly checkup of blood sugars, especially if you have a family history of diabetes or if you have a risk factor of diabetes, because many times patients come to us with already established kidney disease, and at that time we may know that, okay, we at that time we would evaluate and then found him or her to have long-standing diabetes, and by that time kidney disease have already set in. So it is better to have a constant watch and screening for diabetes, and likewise for hypertension also, especially in people who have risk factor or family history and things like that. So basically, if we could control all these two, a major part of kidney disease could be managed, or at least like prevented. And then comes all other measures, like not to take too much of animal protein, especially animal protein, like especially red meat, to because it again increase the workload on the kidney and then tires out the kidney fast. So we have seen, and we have in our daily practice seen more prevalence of kidney disease in people or in population who take too much of red meat. And then of course again to reduce salt intake, because directly and indirectly by it will increase the blood pressure, and directly also it can have an issue with the kidney vasculature, blood vessels. And then to avoid unnecessary painkillers, or take painkillers especially only on advice of a physician, because these painkillers, of course paracetamol is the only safe drug as far as kidney is concerned. All other painkillers do have a direct or indirect effect on the kidney's health. And then of course to take adequate amount of water, especially in this part of the world where kidney stones are very much prevalent. It is very important to take adequate amount of water to flush it out and then prevent kidney stones, because a long-standing kidney stone, especially big stones, can indirectly damage the kidney function also over a long course of time. And then comes proper control of infections, if you have anything. And then there are certain rare diseases, like systemic diseases, like lupus, rheumatoid arthritis, and things like that, where kidneys can also be involved. So we have to keep a watch on that when we are managing these kinds of diseases. Yes.
Thank you. Uh, Doctor, symptoms of kidney disease. Symptoms are very important because a lot of people doesn't care, I should say, don't know that what they're having is a symptom of a kidney disease or it's something else. So just to catch the disease way before time, what are the symptoms of kidney disease?
True. It's a very important question, because there are certain overt symptoms which most of the people don't miss. In the sense, if you have a swelling, in the face or feet, it is most of the people come to the doctor and get the kidneys checked actually. Or say if you have a shortness of breath, or if you have uncontrolled blood pressure, all these things could be signs of underlying kidney disease. Now, but then there are, of course, again, if you have blood in urine, which is overt blood in urine, naturally there is no question that everybody will doubt that there is a kidney disease, or which at least we have to rule out kidney disease. Now, there are subtle findings, so subtle symptoms, which also has to be taken care, so that we can detect, or we can find this or evaluate for kidney disease. There could be other reasons also for these subtle symptoms, but at least kidney disease should be evaluated in these conditions. Like, for example, if you're having persistent muscle cramps, especially in the night, this could be an evidence of silent underlying kidney disease. Of course, there are other conditions also, like thyroid problem, which could produce these kinds of symptoms, but still kidney disease has to be looked into in this condition. Then comes, like, if your urine output is less, naturally everybody will doubt kidney disease. But on the other hand, if the urine output is more, that could also be a feature of kidney disease, especially if you are going to pass urine more frequently in the night, like up to 1 or maximum 2 times in a night is considered to be normal, but anything more than that has to be evaluated. Then comes unexplained anemia. Again, that could be a part of kidney disease, because kidney is a very important organ which is needed to determine our hemoglobin content. Then easy fatigability, that could again be a feature of kidney disease even with a normal hemoglobin. So that could be one thing. Another thing, like anorexia, like lack of appetite, early morning nausea when you brush your teeth, early morning nausea, these all could be, or even simple stomach pain, these all could be a early manifestation of chronic kidney disease. So overt symptoms we often don't miss, but then these subtle findings, subtle symptoms, we shouldn't miss. And many times patients come to us with little advanced kidney disease, and then when we ask the history, they would say that, okay, in our previous medical checkup, the lab people had told that, okay, you had a trace of protein in urine, or little bit of 2 or 3 blood cells, or 3 or 5 blood cells in the urine, which often goes unnoticed or uncared, and then come to us in little advanced stage. So these subtle lab findings also had to be given its due importance, so that we can pick up these things early. Yeah.
Thank you. Doctor, a question is there. I would be taking the questions in the middle also. Is there any genetic predisposition to CKD?
Yes, of course. There are a small subset, like I told you, almost 65% is due to lifestyle. But then there are certain primary kidney disease. Around 10 to 15% are genetic kidney disease. Yes, there are, but genetic kidney disease again can appear in childhood. It can appear in, there are certain diseases which can appear in adulthood and even in older individuals. So, of course, there are genetic predisposition.
Thank you, doctor. Yeah. Doctor, getting symptoms is one part. We've spoken about the kidney disease. We spoke about prevention itself. Doctor, is there a lifestyle and diet to have a healthy kidney?
Yeah, right. This is the extension of what we discussed before. Like, in the sense, basically, as I told, almost majority of the kidney disease patients we see are they have their kidney disease due to their lifestyle issues, like diabetes, hypertension. So naturally, diet control for control of these diseases should be a main thing in management of kidney disease. Like in a patient with diabetic kidney disease, obviously, if you are not going to control your sugars or sugar intake, at least refined sugars, naturally it could result in progression of kidney disease. Likewise, in hypertension, like where now the cutoff, or the cutoff of normalcy for blood pressure is being progressively brought down, since there are more and more evidence showing that a better control of blood pressure will reflect as a better protection for the kidneys and even other organs. So for that, actually, just like for in control of sugars and BP, a good lifestyle is important, like regular exercise, less of salt intake, avoid smoking. Basically, smoking, yeah, coming to smoking, actually, smoking is an independent risk factor for kidney disease, even if it is not associated with hypertension or diabetes. So, smoking can directly damage the kidney, and that is one of the preventable, most common, I think, so preventable cause of kidney disease, leaving apart other lifestyle diseases. So, that is what, like, avoidance smoking, and then again. Avoidance of taking too much of painkillers, reduce animal protein. All these things go a long way in preventing, or at least controlling the kidney disease which we have. Yes.
Thank you. Doctor, I've got a question here from Ms. Helen, and she's saying, is there any way I can avoid dialysis? I'm on stage 5 CKD now, secondary to PKD.
PKD, yeah. Okay. See, stage 5 is again a broad term, like relatively broad term, like in the sense, any kidney function less than 15%, we call it as stage 5. Yeah, unfortunately, stage 5 is a little advanced with its own complications. We can only, basically, we can again keep on trying, like with our basic, we'll stick on to the basics, like control of hypertension. PKDs are more prone for infections, urinary infections. So treat them early, because many of the urinary infection episodes can tilt the balance and then put somebody to dialysis stage. So control the infections as early as possible. Again, make sure that you don't take too much of animal protein, less of salt, and of course avoidance of painkillers, because again drugs like painkillers are one of the most common causes of destabilization of kidney disease, so which can push somebody to dialysis. So these are the things which we can try at stage 5. Yes.
I just wanted to tell you, Doctor, Miss Helen, the one you just answered a question. She's saying my kidney EFGR is 3% only.
Okay.
Right?
Yes.
Yeah,
Yeah, 3%. Well, 3%, unfortunately, many of these centers usually initiate for dialysis, actually, because 3% is pretty low, actually. It's a precarious position, let us say. It's basically an individualized decision, because dialysis, the decision for dialysis, of course, creatinine and GFR plays a major role in the decision when to start dialysis. But then all other factors also play a role, like the patient's symptoms, patient's anemia, hemoglobin control, everything. So the decision to do dialysis is taken holistically. Though EGFR or GFR of 3 is, yes, pretty low. Yes.
Thank you, Doctor. Doctor, another question. If the creatinine is 3, what is the status of
You mean in that sense, at that level, actually, kidneys usually independently not able to take care of body's excretory role or body's health. Actually, like in the sense, kidney is the organ which produces hemoglobin, or hormone need to produce hemoglobin, so that would be deficient. Vitamin D would be deficient. There could be swelling. So kidney at this stage would require some sort of support in form of some dialysis or transplant, I'm afraid. Yeah, stage 3, like 3 ml. Yeah.
Absolutely. Another question. What is the ideal target blood pressure in CKD?
Okay. Basically, in the current literature is like to be less than 140/90 for CKD without protein leak, and to be less than 130/85 with protein leak in urine. But recently, very recently, like probably 2 weeks earlier, we have new guidelines stating that it could be better if it is brought even up to 120/80. So lower the better, but not definitely low than a systolic BP of 115 and a diastolic BP of less than 70. That should be our target. Yeah.
Doctor, moving towards obviously a regular checkup. Doctor, how often should a person get tested for symptoms?
Okay. See, definitely, if you have a risk factor, like in the sense, if you have a family history, as we discussed before, like of diabetes, hypertension, or as we told before, genetic kidney diseases, definitely we need a frequent checkup. There are definite guidelines for all these things. Like in diabetes, yes, we should have a yearly microalbumin, urine testing for microalbumin. Hypertension, again, we should have a yearly checkup for urine microalbumin. And like for and of course it can be associated, it can be taken along with a serum creatinine or blood urea, along with serum electrolytes like potassium, to have a complete picture. Then of course, if you have a specific genetic disease where you know what to expect, like as in the case of PKD, which we were talking before, we would also do a yearly ultrasound scan to see the kidney size, the number of cysts, which is very specific for that disease. So if you know the basic disease which we are suspecting, of course it can be tailored according to that disease which we are looking for. Otherwise, it is basically yearly, at least yearly testing for urine microalbumin, and a routine urine, of course, to see for if there is any pus cells, blood, or any protein, macroscopic protein, and of course creatinine, blood urea, and electrolytes. Yes, at least that would be better.
Doctor, once we have the disease, what is the management of kidney disease? How we should look into that?
Okay. See, depends upon the stage of the disease, of course, but there are certain broad criteria, broad advice which we give. As we discussed before, the things which we needs to do to prevent kidney disease prevail even once we know that we have a kidney disease. Like basically, it is to control hypertension, control diabetes. If it is due to these factors which we have the kidney disease, and of course, hypertension is associated with kidney disease in 80% of cases, which would in turn this hypertension, even if it is a secondary hypertension, this will in turn lead on to further progression of kidney disease, whatever may be the cause. So it is very important to control hypertension very strictly, as we told before, and according to the targets which we discussed before. And then regarding the diet is very important in kidney disease, and we have really in our practice seen a great improvement when somebody really takes care of their diet. Basically, the diet is not very complicated, basically to avoid red meat as much as possible, or to reduce animal protein as much as possible, to reduce fatty food, to reduce salt. So these are the basic things. And of course, to if somebody is prone for high potassium, in most of the kidney disease they are, to avoid foods which are rich in potassium. So these are the and of course to avoid again painkillers which could really alter the course of the kidney disease. So these are the things which we could do, generally speaking, to control our progression of kidney disease. Now there are now, for past few decades, and even certain medicines which have come recently, which are shown to have an independent kidney protection. Like for example, there are various kinds of antihypertensives or medicines for blood pressure management, but there are certain kinds which have an independent kidney protection also. So we could try to use those medicines which will give an independent or advantage or extra edge over kidney disease management. Now there are new kinds of diabetic medicines which has come into market, and then for past 5 years we know that it has an independent kidney and cardiovascular protection. So far, so much so that nowadays we use such medicines for patients even without diabetes who have kidney disease or who have cardiac failure. So preferably we could use such medicines to prevent or retard the progression apart from general control. And of course we should use something for the cholesterol for basically all patients with kidney disease, because of its independent cardiovascular protection, because kidneys health go hand in hand with cardiac health and vice versa. So definitely in all our patients it is advised to use some sorts of statins, what we call cholesterol lowering medicines, to prevent cardiovascular risk which often accompanies kidney disease. Yeah.
Thank you, doctor. Doctor, I've got a question here. I have itchiness all over. How do I manage not to raise my potassium and phosphorus? What should I take to relieve my itchiness? Any medication? I would suggest here, I would request medication. We won't be able to take the name of the medication on live session, but doctor, you can generally just talk about it.
Yeah.
And, definitely, she can always come back to you for
Okay.
a consultation.
True. See, I suppose that itching for this particular patient, probably she would be in little advanced kidney disease, because uh, itching due to kidney disease usually occurs in little advanced kidney disease, not in early kidney disease. Yes, it could happen in little earlier stage also. Especially we could see this in diabetic kidney disease, where itching could happen little earlier in the course of disease. Yes. Generally speaking, it is multifactorial, the itching in kidney disease. A main role comes from dryness of skin, where it could be easily managed by putting some emollients, moisturizers, or even simple oil. And this should be done after having a bath, not before. Of course, otherwise it will wash off. And then, yes, we often use certain kinds of antihistamines for this. And of course, there are other techniques also which are used in dermatology field for itching. Yes, but basically, calcium, phosphorus, all parathyroid hormone levels, all are said to be contributing factors for itching. So we should definitely control these factors also. Yes.
Doctor, another question. When doctors normally advise for dialysis, what should be the creatinine level to start dialysis?
Yeah, see, this is the question everybody asks actually. As I think, as we discussed before, we had this similar question before, like in the sense, the decision for dialysis is basically made uh, not only on based on creatinine, but it is, of course, it's a marker which would definitely help us in making this decision. It is based on considering the patient as a whole. Like, of course, creatinine, kidney function definitely have its own role, but then how far he or she is able to have a proper nutrition, how is their hemoglobin controlled, how are their other organs affected, like if somebody is having associated cardiac failure, probably they may require an early initiation of dialysis, or if they have a uh, other symptoms like itching, as we discussed before, which are intractable for medication. So everything is taken together. If they have any features of fluid overload which is not responding with the normal medicines, or if their serum potassium is very high, so everything has to be taken together when we consider the need for dialysis. But most likely, as per the international studies at least, most people would require dialysis when the kidney functions falls below 6 to 7%. So that is roughly or 6 to 7 ml per minute per 1.73 square meter. So this is roughly the usual level at which we may want to start dialysis, but there could be individual variation. Children children or older age group may need early dialysis initiation. Some people may pull on even later on, but then we would, as doctors, we wouldn't like to take a risk and put the patient in a risk by just prolonging the medical management and then having that patient come to emergency in a bad shape. Yeah.
Thank you. Doctor, who are the kids which are prone to kidney disease?
Kids, children. Yeah, basically, as we discussed before, like basically, if you somebody have a family history, definitely they are one of the risk group whom we should look into. Like there could be cystic disease, there could be stone disease in family, and then these people, these children could have a early kidney disease. And nowadays, childhood obesity is having like is becoming very prevalent, and we often see a mild element of kidney disease in such kids very early in their childhood. And in the same way, we often see hypertension also in childhood because of their lack of activity, the obesity which they have. So all these things usually contribute to kidney disease early in their life. But usually, for mostly, we have to look into the genetic factors, and then we have to concentrate on those people where we can see kidney disease early in their life. Yes, yeah.
Thank you. Doctor, is it safe to take probiotic for CKD patient?
Yeah, there is nothing unsafe about it. Yeah, and now more and more studies are coming into uh, field showing the importance of intestinal microbiome having a very important role in kidney disease. Yes, yeah.
Thank you. Doctor, what is your view of high risk of CKD taking erythropoietin?
Erythropoietin, yeah. See, we all may have to use erythropoietin in kidney disease at one or the other stage of kidney disease. So there is nothing wrong in taking erythropoietin. It all depends upon what is their hemoglobin, what is the current target which we are keeping. So we have to take erythropoietin to keep that target once, but provided we take care of other causes of anemia also simultaneously, like iron deficiency and things like that. Yes.
Doctor, what about alkalizers?
Okay. Alkalizers, yeah, now it's a fad to have a alkaline water and things like that. We really don't know how far it benefits in general population. To be very sure about that, we don't know. But now coming to chronic kidney disease management, definitely alkalizers do have their own role in symptom management as well as prevention of disease progression. So yes, alkaline like sodium bicarbonate is a very commonly used medicine in CKD management. Basically, it reverses the acidity, which acidosis, which builds up in the blood in CKD. Yeah.
Thank you. Doctor, great information you've given me. In fact, to all the audience out there, just wanted to ask you. You just mentioned a lot of times recently regards to not taking of red meat. One thing I wanted to know that red meat is specifically, or is it any kind of meat? The other thing is that how often we should have red meat where it would not affect the kidney also, and we can have it.
Okay. See, again, it depends upon the risk factors. If you're perfectly healthy, no risk factors, then probably yes, we could. But I always suggest not to indulge too much. So, what is red meat in the sense? Uh, like mutton, beef, those things. Like chicken and all considered to be lean meat, like or white meat. Yes. So anything which is basically animal protein as a whole, but red meat especially has a deleterious effect on the kidney health. Now, how often you can take again depends upon, say, if somebody is having coming to me with an established kidney disease, like with a stage 3 or a stage 4 even, I would say no to take at all. No to take at all. Yes. But if it is, well, stage 1 or stage 2, and if somebody cannot go without meat, then probably yes, like once in a month or once in 2 weeks. Yes. Regarding red meat. Yes.
Thank you. Thank you. Thank you, Dr. Sandeep. You have given us a lot of information on this very special day of World Kidney Day. And I believe all the audience who are watching us at this time and who are going to watch it later after the live session, they'll be getting a lot of benefit out of it. Just
Thank
wanted to move forward. Doctor, before we close up the session, what would be a message that you would give, for take home message, I would say?
Okay. See, basically, again, I want to reiterate, majority of kidney disease in our population is due to lifestyle disease, diabetes, hypertension. Of course, there are genetic predisposition to these diseases, so we may not be able to prevent it. But by proper lifestyle changes, we could at least prolong or push back the onset of these diseases. And once it has already set in, we can really do a lot by correct lifestyle management, and of course by proper medication, so that these end organ issues like kidney disease could be prevented. It is very important to prevent kidney disease because of two things. One is that kidney is an organ which doesn't regenerate, unlike skin or muscle. So we have to give too much, very much, like too much importance to prevent damage from occurring, because there is no way to cure. And second thing is that kidney is an organ which affects the health of all other organs. So by protecting the kidney's health, we are basically protecting the body as a whole, including the health of the heart. So it is very imperative to control these diseases so that we don't land up in overt kidney disease. And just to, when we conclude, just to make a few, 1 or 2 lines about the logo of this kidney, like World Kidney Day, is basically living well with kidney disease. Basically, yeah, when somebody is having kidney disease, there are two things which we need to take care, which people often go unnoticed or not given importance. One is to empower the patient to take their own decision regarding their management, because they know best. Of course, the duty of doctors and caregivers are to give them the appropriate information and then aid them to take a decision. But definitely, the patients also and their care and their supporters also should have a equal opportunity and participation. That is one thing. And but actually, such cooperation do a great role in management of the patient as a whole. Second thing is basically symptom management, because these patients should gel well with the population, and they should have a very good quality of life, just like any other person in our society. So symptom management of kidney disease, like as we told before, itching, muscle cramps, fatigue due to anemia, all these things should be taken care of with appropriate medicines in addition to the medicines which we give to prevent or retard the progression of the kidney disease as it is, but symptom management also is really needed to give the patient a very good quality of life. Yeah, this is the motto of this year's World Kidney Day. So that's why I just told that. Yeah,
that's great. That's really super great. Thank you so very much, doctor. Just before we end up the session, I would like to tell here that as Dr. Varma was here to give a brief on the importance of kidney disease and all about what we really needed to know about kidney. If you have any further questions that is really related to consultation, you're more than welcome to please consult Dr. Varma. He is currently practicing in Prime Hospital and Prime Medical Centers. You can see the numbers at the bottom of the screen. You can always call the number for a medical center 047070999, or if you want to book an appointment at the hospital, it's 042929777, and you'll be able to book an appointment as per the schedule with Dr. Varma. Moving forward, talking about if you have any questions coming in your mind later on, you're always more than welcome to, ask us sending an email at myprime@primehealth.ae, myprime@primehealth.ae, and we will be coming back to you. Dr. Varma can answer you
Sure.
your questions, and if it is really required to visit him, he will definitely recommend you to visit. So we would really like to have your feedbacks, and of course we would like you to give us Google reviews and Facebook recommendations in case if you really like it, like the session. At Prime Health is our page on Facebook, and Prime is the name of the channel that we have on YouTube. You're always more than welcome to watch it anytime, as this live session will be there for the lifetime. Once again, thank you very much. And the most important thing that I would like to tell you is that you don't need to call us for booking an appointment now. You can always use Prime Health Me application from Android or iOS to book an appointment for our doctors in Prime, and you can obviously see their profile also. So thank you very much for joining us today. A very, very important message given by Dr. Varma that as it is the World Kidney Day, it is a very, very important organ and a vital organ in the body, and we should definitely take care of it, as we are looking forward to take care of our hearts also. So thank you once again. We will be coming back to you with another live session very soon, and you'll be able to see this live session. You can share it with your friends and family and to your pages. Thank you very much.
Thank you.
Take care, and
Take care.
always remember that Prime is always about personalized care personally. This is what we are here to spread out. Thank you very much. Take care.
Thank you.